COVID-19 situation in India is pretty serious. The country has been facing a deadly second wave for over a month now.
Virus is now spreading faster than any place else in the world.
Indians are facing shortages of critical medical supplies, beds, ventilators, oxygen, and even space to cremate their loved ones. So what can India do to ease the situation? To stop the spread, many Indian and foreign health experts believe that a lockdown would help India break the chain of infections. Last year in March, when India had around 500 cases, it imposed one of the world's toughest lockdowns that somewhat restricted the spread of the virus but was economically disastrous. So this time, the government is not keen to repeat that and has left the decision to states.
We need to save the country from lockdown. I'll urge the states to use lockdown as the last option.
Many states did choose the last option with mixed results. The shutdown in the western state of Maharashtra has achieved some success, but a similar shutdown in capital Delhi hasn't led to a dramatic slowdown of the spread. America's top public health expert Dr. Anthony Fauci has recommended a nationwide lockdown for India.
Well, I think one of the things you really need to do, to the extent that you can shut down temporarily.
While Dr. Ashish Shah of the Brown University School of Public Health has called for a complete ban on indoor gatherings.
Anything that is indoors where people can congregate is a huge, huge problem.
Another top Indian virologist, Dr. Shahid Jamil, believes that localized lockdowns are the way forward. So apart from restrictive measures, Dr. Jha says India needs to scale up testing to identify and isolate infected people early. Currently, India is testing close to 2 million people daily, which the experts say needs to triple. Also, many in India are complaining that testing results are taking 2 to 4 days, which leads to loss of crucial time. This is the most pressing issue for tens of thousands of Indians. They need help and they need it now. Dr. Fauci has recommended taking help of the Indian Armed Forces to make makeshift hospitals. The armed forces are already aiding transport of medical oxygen and helping the civilian administration. Also, earlier this month, the Indian government took a number of decisions, including approving over 500 new oxygen plants across the country, but it may take time for these units to be operational. Though international aid is welcome and much needed, but it may not be enough to solve the current problem alone. Third, and perhaps the key to end the vicious cycle of misery, is vaccination. According to Dr. Ashish Shah, to drive down the cases, at least 50% of the population needs to be fully vaccinated. The UK and Israel have done it, and a downward trend is evident. For India to reach that threshold of 50%, it would need to fully vaccinate close to 500 million more people. But India's vaccination rate has dropped from the high of 4 million shots a day to less than 2 million now. But right now, India has a capacity to produce over 80 million doses a month, and it may increase to over 100 million by July. But given the current pace of 2 million inoculations a day, India would take months to reach 500 million. And by the way, patent waivers on vaccines may also help. But even if that goes through, it may take a few months to ramp up production. Dr. Jha believes the situation in India may get worse before it gets better.
But the next 4 to 6 weeks are more or less baked in. They're going to be very, very hard for India. Calamitous.
Unfortunately, there are no quick fix solutions to India's problems right now. The country is facing its biggest crisis since independence from the British. The international community is doing its bit and needs to continue the relief efforts, because one thing this pandemic has taught us is that until everyone is protected, no one is safe. And those of you watching, please mask up, be safe, and keep India in your prayers.